Welcome to Baker Briefing, where we make news make sense. I'm David Satterfield, Director of Rice University's Baker Institute for Public Policy in Houston, Texas. On Monday, President Donald Trump announced that his administration would warn doctors against recommending acetaminophen, the ingredient sold, among other things, under the brand name Tylenol, claiming it may cause autism in children, and revived a debunked theory linking autism to vaccines. The Tylenol announcement is the latest public health policy development under Secretary Robert F. Kennedy Jr., a long-standing vaccine skeptic. Over the past 9 or so months, Kennedy has appointed members to a CDC advisory committee on vaccines who have spread vaccine misinformation, ordered the preservative thimerosal, whose connection to autism is also unsupported, removed from flu vaccines, canceled about $500 million in grants and contracts for the development of mRNA vaccines, and required consultation with a healthcare provider prior to administration of the COVID-19 vaccine. All as part of the MAHA, or Make America Healthy Again, Commission. Last week, I talked with two returning guests, Kirstin Matthews, Fellow in Science and Technology Policy at the Baker Institute, and Rekha Lakshmanan, non-resident scholar at the Institute and strategic officer at the Immunization Partnership, about the Trump administration's move under the MAHA banner and what they mean for the future of vaccination and public health. Kirstin, Rekha, welcome back to the show. I want to start with some fundamental questions. Now, some 8-9 months into the administration, what exactly is the Make America Healthy Again movement? What are its actual aims? Who makes up the coalition leading and supporting it?
So the MAHA movement, or Make America Healthy Again, really started with RFK Jr. during the campaigning when he aligned himself with President Trump. And the goal, which sounds nice, is to help America become healthy. We do have an increased number of chronic diseases, and we have some increased obesity. There are things that we can do definitely better in the United States. So beyond just RFK, it's kind of a broader consensus. He brought in people to head, for instance, the FDA and the National Institutes of Health, NIH, and that funds the majority of biomedical research in the United States and is one of the largest funders in the world for biomedical research. They also kind of prescribe to these mindsets. And then when you look at the public, I think it's actually, they read into it as making us healthy as kind of something that's good for us, but they don't see what underlying this is, which is promoting kind of these unproven ideas that range from, as we kind of briefly mentioned, vaccines, saying that they're harmful to us, but also the other end of the spectrum is promoting things that have no evidence they work. So, for instance, using stem cells just to cure something like autism has also been promoted by the administration. So overall, I think it's just an effort to remove the expertise within, I think, a lot of our health and human services, including the CDC and the FDA.
You know, I would look at the MAHA movement as a vehicle moving away from evidence-based science and information to discredited, let's make up information as we go along. The FDA and the CDC and those institutions, we have to remember that they are, at the time being, highly regulated, rigorous institutions where we have people who have dedicated their careers into research and to science to give input into how drugs are approved, how studies are done. And now we've seen this movement towards, frankly, unregulated, unscientific, grifting movement, which is the health and wellness industry. If you look and see how much money, and I think it's also important to follow the money, if we look and see how much money the health and wellness industry is making and what their projected income is going to be, we're looking at trillions and trillions of dollars. And one of the talking points certain MAHA supporters use is this concern that, for example, the pharmaceutical industry is making money off people But I would also say go and look at how much the health and wellness industries are making. They're in fact making probably a lot more money than pharmaceutical companies are making, either through their pharmaceutical products or frankly through their vaccines. Because at the end of the day, when you look at the revenue generated by vaccines for a lot of these companies, it's fairly negligible compared to the bigger pot of money.
On the issue of vaccines, the question of mRNA vaccines has come up. It's not the first time. Can you explain a bit what are mRNA vaccines? What is the claim regarding them that those in the MAHA movement, RFK Jr., are making?
So mRNA vaccines are actually really new, but the technology has been under development for quite a while, and it was actually part of the global health movement. It was focused predominantly on things like malaria, tuberculosis. These were really hard to actually fix. And when the pandemic happened, all these companies that had been working on it had pivoted over to the COVID one. So what mRNA is the building blocks of the body. You have DNA, and that encodes all the genes that show who you are, make you an individual. And how that's processed is it goes through the mRNA pathway in order to make the proteins. And the vaccines themselves are trying to add that mRNA for COVID, a small section of the virus, one of the little proteins, and that gets excreted and then causes an immune response, which is good because that primes your system. So when you actually see the virus, that you can actually attack it a lot faster. So it doesn't have those severe symptoms like we saw when we had closed down many different countries. I think people keep forgetting what happened in New York City, what happened in like Milan, Italy. We closed down cities because there were not enough healthcare workers to help the individuals that were severely sick with COVID. And this is because we vaccinated a huge portion of society that now when you get it, it's a lot less severe.
So these vaccines, mRNA, are safe. They can be developed to deal with health crises. Why then has federal funding for them been cut? What's the justification that is specific to mRNA vaccines?
It's a few different things. I mean, one is the deceptive information machine that has been going out there and being perpetuated by groups and individuals. I think also going back to the pandemic, while the mRNA platform has been around for a very long time, it's not as if, in a matter of days, researchers and scientists, discovered the mRNA platform, discovered a vaccine, and then pushed it out. I mean, this has been happening for years and years and years. The rapidness of utilizing the technology around mRNA to develop a vaccine and then to get the vaccine reviewed and approved through the emergency use authorization process was really phenomenal. And I mean, I think we all have to go back and remember what it was like in 2020 and 2021, when at first we didn't know what was going to happen. We didn't have a world of a vaccine to help us get us out to the other side of the pandemic. And we had Operation Warp Speed, which was just an incredible feat where we were able to use this technology that's been around for a long time and apply it to a vaccine and then get it deployed. But naturally, the speed in which that happened, I think, created a lot of confusion and a lot of concern. And then, of course, what happens is that you have people who capitalize on people's fear and people's questions. And then it became a money-making proposition to spread that fear and that disinformation, which I think has led to this bigger negative connotation around mRNA platforms and vaccines.
Is there any kernel, small as it might be, to the allegation that the vaccines, when introduced, produce side effects? And I would follow that up by saying what medication does not have, in incidences that can be very small, side effects or negative consequences?
I think we need to be fair, which is, and you hit the nail on the head, any medication, any vaccine we take can produce side effects. I don't think it's accurate and it's disingenuous for us to say that, no, nothing is going to produce a side effect. There are always side effects. I think, however, we have to look at it in the bigger context and look at, okay, well, what kind of side effects do these vaccines have, or at least the most common side effects? And when we look at it, and what it boils right down to is that the side effects, could potentially happen, but for the most part, There are common side effects such as pain at the injection site, a little bit of fever. Some of those rare side effects that could happen in people are just that, they're rare. And so I think it's to contextualize what we're talking about in terms of side effects. So can vaccines cause side effects, or can side effects happen as a result of getting a vaccine? Yes. But when you look at it at the end of the day, they're fairly common side effects that go away in about 24 to 48 hours.
Let's focus down on two issues which seem to be either shapers or drivers of RFK Jr. and the MAHA movement. The first is the phenomenon of autism and the increasing incidence, or to be more accurate, the increasing diagnosis of autism, which RFK Jr. cites as an example in what in logic we would call after this, therefore because of this phenomenon. He blames this on vaccines, on medications in general. What's the reality here?
So this is actually fascinating. There's things that happen at the same time that doesn't mean it causes it. We've also seen them linking vaccines with increased chronic disease because we got more vaccines and we got more chronic diseases because we weren't dying of infectious diseases earlier. So just because they're happening in the same space, it don't make the two related. There's a lot of things that are going on. We're waiting a lot longer to have children. Maybe that has some impact on it. We're diagnosing it significantly better and taking care of those children better than we were before. There are some small side effects that we've seen that are kind of linked and we've been trailing them. That could be something that, for instance, you get a vaccine, it's the first time you have a huge fever, and that could be what the triggering effect to having some mental issues within a child. That isn't really the vaccine, because if you hadn't had the vaccine, you would have a fever at some time in your life that would also trigger these side effects as well. There's all these little subtle things that are going on. I will say we've spent, I would probably estimate, I don't have the number in front of me, I would say $1 billion looking at a link between vaccines and autism, and we can't see anything. There's nothing showing up. There might be a really small, like less than 0.1% of people that might have a reaction to it as a child. But this is not what you're seeing in the population of the U.S. This isn't something that is a huge one that we should fear like we are right now. And there's not a link that we should ban vaccines that are helping control infectious diseases. We already saw a huge outbreak in the state of Texas of measles, which was preventable. And 2 children died in Texas, and it's still spreading across the country. We could have prevented this. We could prevent the future side effects from having measles as a child. We just assume that those individuals that got over it are perfectly fine, but we don't know whether or not they're going to have a chronic condition associated with measles, which is just as severe, if not worse, than what we're talking about for these really small number of that got associated with the vaccine.
Yeah, and I think another thing is that, we're seeing the goalposts get pushed back and also expand because, there were reports that Tylenol now could be potentially linked to autism. And so there's this shifting that's happening again, because I think we need to look at where the opportunities are for these people who are making these accusations, which are unfounded. But again, I think it is to prey on people's concerns and fears, which motivates others to capitalize on that through, frankly, money.
Lawsuits.
Mm-hmm.
Right. And you have to acknowledge the tragedy of autism when it is particularly severe leads people in the situation of caring for those, loving those with autism, to seek the why. And the why is all too easily converted by demagogues and hucksters into the who. Someone must be responsible for your child's or your sibling's condition.
Or something.
Yes, or something. And if we haven't found the thing, it's because there's a conspiracy to cover it up.
Absolutely. I think all of us have compassion for families who have children with autism. I can only imagine how difficult it is. And when parents are seeking something tangible to have a direct link, And so for those parents who were seeking answers, we can appreciate and we can understand that. My frustration is those individuals who are trying to redirect resources and funds to really understand what the causes of autism are when we already have a preponderance of evidence to show that vaccines are not the cause. Let's try to really invest in finding out what the potential causes are.
Let's go to a question many of us ask ourselves. Had it not been for the COVID pandemic and the responses here in the United States, but also around the world, the masking, closure of facilities, closure of schools, could an RFK Jr. have come to the position that he has now? Could the steps taken within the CDC and FDA have been possible? Were it not for the reaction to, the response to COVID and the sense that the experts didn't know what they were doing, they forced us to do things that were not rational, so let's throw them all out?
This is an interesting question. I saw all of this, and Rekha could attest as well, within the state of Texas, this movement of why the individual and we should have our rights to do whatever we want, and we shouldn't have to take these vaccines, and we should make it so no one has to take these vaccines, was bubbling up in Texas for over a decade. And I remember distinctly in 2020, when we started talking about having a vaccine, Rekha sent me a picture and said, oh, these people protesting for masks and mandates, they're going to shift over to vaccines as soon as it's available. And that's exactly what we saw. And they were there to jump. But I feel like if he didn't come today in 2025, he was on his way, or somebody else of that character was on their way for high prominence, that we were going to see this in the future because of the way they've been manipulating the public. And I have friends who believe this. So we cannot have conversations about what I do for work. I'm really conservative on how I talk about what I do for a job because I don't know what the response are. But they're sending things online, talking about how great it is, talking about vaccines causing autism. And I know it's definitely from some personal tragedy or something they view as a tragedy with a family member actually having autism, and they're having to deal and cope with that.
I think there's something else happening here. And Rekha, this falls squarely within your work with the Immunization Partnership. Too much time has passed, and the memories are either not there at all or they have faded, of when major infectious diseases, polio, measles, German measles, the complex of diseases which killed, crippled tens of thousands, hundreds of thousands of people in the places where you worked, played, went to school. The evidence was everywhere around you. Because of the success of science, because of vaccines, because of mandates for vaccine, for school entry, and for other employments, we managed to conquer that, one of the greatest achievements in the history of science. But that was a long time ago, which is to say, before social media. How do you try to inform the risks that are present? These diseases aren't eliminated. Only smallpox falls into that category. They're there in the wild. They'll come back if there is a sufficiently low level of immunization. Florida, of course, is leading the nation in that direction right now if their vaccine mandates for schools are indeed lifted, if that is actually what happens in Florida. But how do you go about educating on what we all assumed was a basic understanding from every parent's perspective, that if they wanted their child to live, not be paralyzed, not have a debilitating condition, and measles can be a very debilitating condition. I had it as a child, and it was very severe. What do you do?
Well, I think first and foremost, we are a victim of our own success. To your point, we don't see a lot of these infectious diseases like we once saw, although, we had a large-scale measles outbreak in Texas, and sadly, we had 2 young unvaccinated children die because of measles. And I think, it is going back to the old notion of storytelling. I mean, we still live amongst people who saw firsthand the devastating effects of polio. We have people who say, I remember standing in line at school with my fellow classmates waiting to get the polio vaccine. Years ago, a story I like to tell, we brought in an iron lung machine into the state capitol, and we staged it for an entire week. And the responses and the reactions from people, both lawmakers, their staff, but the general public, was incredible. We had some people who said, what is that? It looks like a barbecue smoking pit. And then we had some who immediately recognized it as, oh, is this an iron lung machine? And, that's what it was like decades ago when we didn't have a polio vaccine and you saw hospital wards with iron lung machines lined up taking care of children who were paralyzed and needed a machine to help them breathe. I met a physician years ago who still practices medicine, but he was a child of polio. He has braces on both his legs, and he's in his early 70s and has explicitly told, his patients and his families, I don't want your children to have to go through what I went through. And so I think we as a community need to do a better job of lifting those stories and those voices of, look, this is not where we want to go. And this is where we are heading if we see more and more parents choosing to not vaccinate their kids.
I'll ask you both, and it's a pretty harsh question. Are we going to have to see a return of children dying, losing their vision, hearing, being paralyzed in order to restore what was assumed to be a basic social mandate around the world in order to participate as a healthy person in society? Is that what it's going to take?
I'll be honest, I don't know where the bottom is, in the sense that we just saw a few months ago 2 children lose their lives from something that's preventable. And yet we still continue to have dialogue and discourse that, well, it's a parent's choice. Of course it's a parent's choice. No one has ever argued against that a parent can't choose whether or not they want to vaccinate their children. However, this is one of those things that it not only affects you or me, it affects others. I hope it doesn't get to the point where we have to see dozens of children dying or hundreds of children dying. But where we are right now, that may be the point we have to get to for people to pause and stop and say, okay, hold on a minute. We need to course correct.
There's a legal mandate that freedom of speech must be respected, but that does not extend to standing up in a crowded theater and shouting fire. Freedom of choice, when the freedom of choice is, I wish my child to go to school, a public school, with your child, but I don't want my child vaccinated, no has been society's answer. That is not a choice you are free to make. If you elect to send your child to a public school, they must be vaccinated. It isn't a choice. And perhaps a reminder that your rights and liberties are extraordinary, but where they threaten the rights and liberties to be healthy of everyone around you, there are limits which we as a society, the globe, has imposed. And to roll them back will almost certainly mean we are rolling in a return to the tragedies that I lived through when I was a small child and saw around me. I would hope that's not the case. But the combination of crackpots, conspiratorialists, the genuinely frightened, sick at heart from personal circumstances, and the grifters, that's a tough, tough wall right now to fight against.
I think I agree with Rekha. I don't know where the bottom is. And I actually partially blame those individuals who are leaders in our communities for actually not standing up enough to say you should be vaccinated. Immunization is important, especially religious leaders. Not being able to say as a Christian pastor that this is what you do as a Christian to help those that are less fortunate, those that are compromised, those that are younger. This is what Christians do. And instead, we hear more of the language, unfortunately, from people that go to my former church that it's an individual right, like a religious freedom. And it's not the same, because should be part of lots of, I think, the religions have similar mandates of helping others who are in need. And this is part of it, I think, is vaccination. You can do it. You should be doing it.
This is a topic which we at the Institute will be continuing to talk about, because it has to be talked about. And I would agree there is a communication gap here of how do you message what we never thought in our lifetimes would ever have to be messaged again. Do you want to have a healthy child? If you do, there are certain things that you need to do, and it's not cod liver oil and it's not snake oil, although there's plenty of that out there. It's following the same scientific facts which have been demonstrated with enormous sacrifice and effort over the past 150 plus years. You can take it back to the 18th century for smallpox. Immunization works. This has been Baker Briefing, where we make news make sense. The podcast is brought to you by Rice University's Baker Institute for Public Policy, which delivers nonpartisan policy research on the most pressing issues facing the United States, Texas, and the world. Share your feedback and your guest or topic suggestions at bakerbriefing@rice.edu. This episode was produced by Corinna Zemel with support from Sammy Beck. AV production was led by Kevin Young. Learn more about our work at bakerinstitute.org, and thanks for listening.